Last week, when we announced some rollbacks around our restaurants and a number of other businesses, we did make it clear that we are sadly seeing an increase in the number of COVID cases. And in fact, last week, our reproductive rate was at 1.2, and today it's at 1.3. Just this past Friday, we've seen an increase in over 200 cases. Our cases as of today are 13,756, with 38 people who are hospitalized, 156 people who have lost their lives since the beginning of this pandemic in San Francisco in particular, and our positivity rate is at 1.87. Dr. Grant Colfax is joining me today to talk more specifically about the numbers and what they mean and where we are, the same way he did so last week. What we're seeing here and what we've seen all over the country is what looks like to be a significant uptick, one that we have to pay attention to, and more importantly, one that has put San Francisco, which has been really a leader on fighting against this pandemic, it has put all of the incredible gains that we have made at jeopardy. Effective tomorrow, we have been informed by the state of California that we will be going from the yellow tier, which we were so proud to be at, to the red tier. And what that means is, sadly, a number of things will need to come off the table. One of the things that I've made clear from the very beginning is we are going to proceed with caution so that we can do everything we can to avoid a complete shutdown. And as of tomorrow, we will need to, unfortunately, roll back non-essential office space, making sure that people who are non-essential that have opened their office spaces will need to close them at this time. And unfortunately, the gyms will need to go from 25% down to 10%. These particular things were mostly chosen because under state law in red, we have to follow those guidelines, but also we understand that there are certain things that put us more at risk of increasing the virus than other activities. And again, Dr. Grant Colfax is joining me today and will explain some of the specifics around what this means for our city, especially in light of what we see happening. And we want to continue to make sure that we don't go backwards. And how do we do that? We don't go backwards by not getting comfortable, not getting complacent. You know, the weather has been pretty nice, even though it's been cold, but the sun has been shining. People have been enjoying San Francisco. I had an opportunity to walk around the city this weekend, and I saw so many people out and about, you know, enjoying the parks, doing, you know, walking, jogging, hanging out at the restaurants and other things. A lot of people were outdoors. And what we have to continue to do is not get comfortable, because the fact is the virus is still out there. And we are still going to have to adjust to this so that we don't continue to see a significant spike in San Francisco. What's happening next week, of course, is one of our favorite holidays, and that's Thanksgiving. And so we know that so many people want to travel, and then there's other family members that want to come visit. The Department of Public Health has put out a travel advisory asking residents to avoid non-essential travel. But more importantly, we need to think about the folks that come to visit us as well, especially in places where we are seeing, you know, higher case numbers. This year, we're asking people to sacrifice, because if Thanksgiving, when we get together and we see large family gatherings, especially indoors, when those happen, we could be dealing with the impacts of those decisions by Christmas with a significant increase in hospitalizations. So what we're asking people to do is sacrifice. Sacrifice and put off the things that we all know and love, especially during the holiday season, for the sole purpose of trying to get to a better place, and for the sole purpose of making sure that people don't continue to catch this virus, and so that folks aren't continuing to be hospitalized, and that we don't see an increased number of deaths as a result of wanting to come together for the holidays. This is where we are now. This is me sounding the alarm. This is me asking San Franciscans to do exactly what I've been asking this entire time, to make adjustments, to make sacrifices, and to do everything you can to remember that this virus exists and make sure that our behavior and what we do helps to avoid circulating the virus in the first place. We remember not too long ago when we finally made the announcement that we would be opening gyms and hair salons and nail salons. Just think about how good it felt to feel normal, to go and get your hair done or your nails done, or to go and work out at the gym and enjoy your time there. But just think about how much more important it was to the people who were finally able to open their business, who were finally able to get a paycheck, who finally had some level of certainty in their lives that they would be able to take care of themselves. Now think about what's happening now. I'm sure that so many of those people are scared. Last week, we told the restaurants that they would no longer be able to operate indoors. What that meant was not only layoffs, but it also meant that there was a lot of lost revenue because of the food that they no longer were able to use. When you think about some of the things and the sacrifices that people are making, that's what makes me continue. As much as I want to be around people and I want to be around friends and family, it's why I choose to make sure that I'm doing my part by keeping my distance and by avoiding large crowds and by not getting complacent. It's not just because I'm the mayor of the city and I'm asking you to do it. It's because I want to get our kids back in school. It's because it pains me every time we have to make an announcement to close a business, because I know what that means financially for that business. And it's been very, very difficult for so many people. We know that since this pandemic began, almost 300,000 San Franciscans have filed for unemployment. And we know that people continue to suffer financially. And we also know that people are still in the hospital and people are nervous and concerned about their own personal health. We know that we disproportionately seen a lot of infections in our Latino community. And we made significant investments, and we are seeing a real difference. I'm really proud of that work, but there's more that needs to be done. Because when we look at the data, which has been the driving force behind every decision that we have made, we make good decisions. We make adjustments as it relates to the data. One of those such adjustments is moving a SOMA location, a testing location, to the Alamany Farmers Market. Because we know in this community, which touches the OMI, it touches the Bayview Hunters Point, it touches that whole region. We know that there is a need for more access, more consistent testing. This location was doing over 500 tests a day, and in San Francisco, we're doing close to 5,000 tests a day. And when I think about how far we've come, being able to provide people their test results anywhere between 24 and 48 hours, it is significant. And when I look at the maps of what shows us specifically where the areas which carry the higher infection rates and where the areas are that have testing both public and private, we had to make an adjustment. We had no choice. So tomorrow, that location will be at Alamany's Farmer Market. And I'm really grateful to the Department of Public Health and the work that was done in order to make the adjustment and to move the site to this specific location, as well as the work that has been done to get us to this point where we are adjusting to the needs of the people of San Francisco. This will continue to be a challenge. And it's hard to get up here and tell people that you're going to have to close your business You're going to have to make some adjustments. You can't see your grandmother who is in a nursing facility. You can't hang out with your friends. Children can't spend time with one another like they used to. It pains me. And so because of that, we need everyone's cooperation so that people's lives aren't impacted as a result of our decisions. We've come a long way, San Francisco. We have been a leader on combating this virus. We should be so proud that we've done an incredible job. And now I'm asking for more. And I know it's hard. I know it's hard every single day that you have to make that decision. I know it's hard, but I'm asking for more. As we come up on the holiday season with a different kind of flu, and hopefully you got your flu shot, we know that this is going to be a next tough couple of months. So let's continue to do our part. Let's continue to be creative and keep our distance. Let's minimize the number of households and the people that we interact with. Let's cut back on those holiday dinners with large families gather it on the inside. Let's do what we can so that we can see the change. And as we see the change, that will put us in a better situation to begin to reopen our city and to put our economy back on track and to put our kids back in school and to look behind us and say, because of everything we did, we are in a better place, and we are so grateful for the sacrifices that we all made to get there. Thank you all so much for your cooperation, and at this time, I want to introduce Dr. Grant Colfax to talk specifically about the data, where we are, what we need to continue to do, and information from the Department of Public Health. Dr. Grant Colfax.
Well, good afternoon, and thank you, Mayor Breed, for your ongoing leadership during this difficult time. We are now experiencing a massive surge on the national, state, and regional level. And let me be clear, San Francisco is in the midst of a major surge of COVID-19 cases. It is sobering that we have reached this point again. And as you know, this is the third surge we have experienced. And unfortunately, the virus is moving aggressively in our community. And unlike the previous two surges, this surge is impacting every state in the nation. In the last 2 weeks, new COVID cases in the United States have increased by 80%, and deaths have increased by almost 38%. The U.S. continues to surge. The CDC cited a new record of 44.8 new cases per 100,000 as of November 14th. And as you can see on this slide, San Francisco is trending behind the national average of cases per 100,000. But that is no reason for us to believe that we couldn't catch up to that average and catch up quickly. In California, we are seeing the fastest growth in daily cases since the pandemic began. The rate of increase that we are seeing in California is faster and steeper than the summer surge. And here in San Francisco, we are seeing an explosion of new cases throughout the city, with the virus becoming more widespread. Next slide, please. We are now averaging 10 cases per 100,000 people, which has placed us in the red zone of our San Francisco indicators. You can see, represented in these blue bars, the sharp increases in cases we've had since October. And the black line represents the 7-day rolling average of new cases in our city. From October 10th to November 10th, daily new COVID cases jumped from an average of 29 cases a day to 97 new cases a day. For an additional perspective on how fast this virus is traveling, let me share some additional numbers. It took us 29 days, nearly a full month, to go from 11,000 to 12,000 total cases in San Francisco. It took us 18 days to go from 12,000 to 13,000. And now we anticipate it will take us just 12 days to go from 13,000 to 14,000 cases. Let's go to our next slide. This slide shows our increase in cases in San Francisco per 100,000. Again, you see the rapid rise. Again, this rate of rise is higher than ever before. Right now, our other health indicators remain stable. Our hospitalizations remain stable at the green level. However, and unfortunately, we do expect to see an increase in hospitalizations to follow this increase in cases. We currently have sufficient hospital bed and ICU intensive care unit capacity, but if this surge continues, we could exceed that capacity, as unfortunately we are seeing in certain regions and states across the country. And we continue to test more than 5,800 people a day, more than any other jurisdiction we are aware of in the country. Our testing rate, 5,800 people a day, and we are contact tracing over 85% of cases. So let me take a moment to talk about the state tier changes. Today, the state announced that almost every county has seen an increase in cases, and in most cases, that increase has been dramatic. Because the virus is moving so quickly, the state has placed 41 of 58 counties in the most restrictive purple tier. San Francisco has been placed in the state red tier. We have moved from the least restrictive tier, yellow, to where virus transmission is minimal, to this red tier where virus transmission is substantial. That means instead of moving back to just one tier, to orange, as was previously anticipated under the state system, we have unfortunately moved back 2 tiers. This indeed is indicative of how fast the virus is spreading in our city. And as the mayor already mentioned, due to our red tier designation, we will have to close non-essential offices and have people return to remote work, and reduce gyms and indoor climbing walls to 10% capacity. We do not want to continue to move backwards, but additional restrictions could become necessary if each of us does not take immediate action today to do our part to limit the spread of the virus. So let's take a moment and think about that. And let's think about how that relates to the upcoming holidays. Holidays that I wish we could all celebrate as we did during normal times. These are not normal times. Next week is Thanksgiving. And as hard as it is to say this, please do not travel. Please do not travel. Stay at home with your immediate household. As hard as that might be, we must all exercise caution and do our part. And please, do not use testing to determine whether you can travel or not. We have seen the repeated failure of this type of testing strategy across the country, including in Washington, D.C. A negative test cannot be an excuse to put yourself or others at risk. Please remember that people who test negative can still harbor the virus if they are early in their infection. That is why when people are exposed to the virus, they must quarantine for 14 days, regardless of their test result. San Francisco, once again, we simply must double down or triple down and do everything we can to stop the spread of the virus. We cannot be reckless. We must not be complacent. We must take every possible precaution to protect ourselves, our families, and our community. The choices we, the choices you, the choices I make in the next 2 weeks will determine the remainder of this holiday season. We have the ability to choose if we beat back this third surge or if we fail victim to this surge, like we are seeing, unfortunately, in other parts of the country. We can choose by the actions we take this week and the upcoming weeks. The safest way to celebrate Thanksgiving is to stay home with members of your own household. Don't expose your loved ones around a holiday dinner table. If you are going to gather, and again, I strongly recommend against it. I strongly recommend against it. Keep it to no more than 6 people and keep it outdoors. And keep those masks on, period. The best way to celebrate this year is virtually and giving your friends and family the gift of good health. As we have learned these past months, this is a treacherous virus that spreads throughout our city. And we have also learned that together we can beat it back. We've done it twice, we can do it again. I know that everyone is tired and fatigued, and I know I can sound like a broken record. But COVID-19 is not resting, and neither can we. Remember, we know how to slow the spread of the virus. Limit gatherings, wear your mask, do activities outdoors, stay physically distanced, and practice good hygiene. Let's be cautious, diligent, and safe. Let's make sure that we and our loved ones are here for that vaccine so that we can really celebrate big next year. Thank you.
Thank you, Dr. Colfax, and welcome, Madam Mayor, as we begin the Q&A portion. Madam Mayor, whenever you're ready. The first question comes from Kathy Novak with KCBS. Madam Mayor, should public schools continue to aim for a January 25th target date for reopening, given the latest data?
Definitely. The fact is, schools are essential, and it's important that we do the work now to get our schools open as soon as it is safely possible to get them open. And the fact is, we had talked about this before, the science makes it clear that the spread of COVID amongst elementary and middle school students is not the same as amongst adults and kids who are in high school. So we know what the data is, we know that educators and others are involved, and we know that it's so critical that between now and January, we do the work to prepare so that we can safely open as quickly as possible. We don't stop just because we're dealing with this, and we're hopeful that as we go through this very challenging time, we'll get to a better place. But ultimately, our office has provided a significant amount of resources to the school district to continue the process so that we are prepared to open as quickly and as safely as possible.
Thank you, Madam Mayor, and thank you for your time. We now have a few health-related questions for Director Colfax. Dr. Colfax, the first set of questions are from Juliet Goodrich with KPIX. In terms of testing, is there an increase in demand, or is the city shifting resources to provide better access in more impacted areas?
Well, as the mayor mentioned, we are moving more testing resources where the virus is most concentrated in the city. I'm really proud to emphasize the fact that San Francisco is now averaging 5,800 tests a day. That's higher than any other jurisdiction we are aware of. And from the beginning, we focused on ensuring that people have access to testing who are essential workers, who have symptoms, who have a high-risk exposure, or who do not have insurance. The city is also currently conducting 55% of those 5,800 tests. We have mobile testing pop-up sites as well in the southeastern part of the city in particular. So we continue to scale up our testing efforts. We're also working with private providers to ensure more testing is available. Kaiser, for instance, has greatly eliminated many barriers to testing. So that is another place where we expect to see a great increase in testing.
Thank you, Doctor. The next set of questions come from Annika Home with Mission Local. The new case rates are up in the Marina and Presidio Heights. Any explanation or comment on that?
Well, I think that this reflects the overall surge that we're seeing across the city right now. It's important to emphasize that the virus still remains concentrated in the communities that have been most impacted by the virus, including in the southeastern part of the city. High rates, disproportionate rates among the Latino community in particular. This needs to continue to be a focus of our efforts, but we're seeing an increase across the city, likely due to the fact that people are letting down their guard, which is why it's particularly important that no matter where you are in the city, that everyone does their part to reduce the risk of the viral transmission. This is not a time to let up. This is not a time to socialize in close quarters with other people. Keep activities outdoors and wear those masks.
Thank you, Doctor. The last set of questions are from Dan Kerman with Cron 4. Is there any plan to reduce occupancy at retail stores or personal services, such as salons? And similarly, if San Francisco were to drop to purple, what would that mean for businesses?
Well, look, we're really focusing on trying to keep from moving further backward, which is why it's so important, again, that during this holiday season, as we see the surge, that everyone do their part. If we go into purple, we will need to take the steps that the state requires, that purple requires. Right now, we do not have any immediate plans to place further restrictions. As you know, indoor dining closed on Saturday. We're emphasizing the fact that people should not travel during the holiday season. We hope that this is enough to beat back the surge, but again, it's really incumbent on all of us doing our part to start having things move back in the right direction again.
Thank you, Dr. Colfax, and thank you, Madam Mayor, for your time. There are no further questions, and this concludes today's press conference. Thank you.